We've called it a network because it's about so much more than just one service.
So Lucy, why is it important that we're all involved?
Well, the Jersey Care Inquiry came from historic disclosures of physical and sexual abuse in Jersey's care system for vulnerable children. Many of the children who are involved in the inquiry are still living on the island now as adults and have been left to manage the traumatic memories of their childhood experiences. Recommendation 8.4 of the Jersey Care Inquiry specifically targeted legacy issues for survivors of childhood abuse. Francis Oldham, QC, stated that Jersey needed to respond by further developing accessible services to meet the recovery needs of survivors on the island, and that these needed to be reviewed on an annual basis by statutory and community sector providers. In response to this recommendation, we want to support the development of a trauma-informed island and a trauma-specific network. We believe that this is possible through partnership working. No one should be in this alone.
So why make this video?
We wanted to reach out to our colleagues, particularly to GPs, in a way that was accessible so you can be involved, informed and have your opportunity to develop the network. We've been having engagement sessions like this in the daytime and the evening, at the hospital and in the community with our health and community partners, our stakeholder partners, members of the community and survivors of abuse. This video is the last part of the engagement phase. We're asking for your feedback and details of this will be given at the end of the video. By the end of this short video, we hope that you will be able to answer the question, what difference is the Jersey Complex Trauma Network going to make to me and to my patients? The video comprises 3 sections, approximately 8 minutes each in length, so you can watch it all in one go or in parts. By the end of section 1, you will understand what the Jersey Complex Trauma Network is, how it would operate, who it's for, and how you would refer. By the end of section 2, you will know a patient journey through the network. By the end of section 3, you will have knowledge of what we require in order to resource and establish the network. So let's begin.
So Lucy, what do we mean by trauma?
Well, there are 3 different ways that we can look at trauma. There's single incident, for example, in a car traffic accident. Complex trauma describes a person's repeated experience of trauma, usually over a prolonged time, for example with childhood abuse. The third kind, vicarious trauma, is when somebody is repeatedly told about or witnesses abuse, for example a child in a domestic violence situation.
So people are clear, should anybody who's experienced trauma access this network?
Well, people respond to trauma in lots of different ways, depending on the person, the type of trauma, their support structure and their previous experiences. So no, not everyone who's experienced trauma would access this network. Firstly, because not everyone needs additional support from specialist services, and secondly, because the types of support that are required after a single incident or multiple trauma are different. The Jersey Complex Trauma Network that we're describing is for people who've experienced complex trauma.
So what services are available for people who have experienced a single event trauma?
Well, the most common difficulty that people experience after a single event is called post-traumatic stress disorder or PTSD. And this is usually diagnosed a month or so after the incident if the person is still experiencing distress, memories or maybe having nightmares of the event. They might find that they're avoiding things that remind them of the event, and they might feel like they're more on edge or what we'd call hyper-aroused. Now, we've understood PTSD for some time, and there are services that are already available on Jersey through Jersey Talking Therapies, or JTT as we know it. Our clinicians in JTT can offer treatments approved by NICE guidance to support people with PTSD.
So the network we're talking about is really only for people who have experienced complex trauma?
Yes, so it's for people who are aged 18 years and over who've experienced complex trauma and who would like support in managing how it's impacting on them. So this would include people who've experienced childhood abuse, ongoing domestic violence or abusive relationships, people who've repeatedly witnessed trauma or abuse, people who may have been forced into sex work, It would also include people who have been abducted or are prisoners of war. What we understand about complex post-traumatic stress disorder is that if people are more likely to develop it if they're exposed to trauma from a young age, if the trauma was prolonged, if they had multiple experiences of trauma, and if the person who was harming them was somebody who was close to them.
So what is C Ptsd?
So our knowledge of C Ptsd is still developing. So as you know, Tara, here in Europe we use the International Classification of Diseases, ICD-10, to define mental health symptoms and disorders. So in May of this year, ICD-11 will be presented to the World Health Organization, and for the first time it goes beyond diagnosing single event PTSD, and it means it will start to diagnose multiple event C Ptsd. This means that internationally we have growing clinical recognition of the difficulties that people experience following complex trauma. Now, one of the key symptoms that people experience is loss of trust in other people, making it difficult to develop and maintain relationships and engage with services. People can also experience what we call emotional flashbacks, which are intense feelings which may have originally been felt during the time of the trauma, for example, fear or guilt or shame. Now, someone with single event PTSD might feel like they feel very changed by the incident, like they feel like a different person, whereas somebody with C Ptsd may have no sense of themselves at all. It can pervade every aspect of their lives, making it harder to make sense of emotions, to manage outbursts of feelings, and to know how to calm oneself.
So if I was a GP, Lucy, what would I look out for in my consultation?
So in addition to the symptoms that I've been describing, what we know about childhood traumas that can have long-lasting effects on physical and mental health. We understand that disclosure can be difficult, and so sensitive questioning and awareness are key. Prolonged trauma increases the likelihood of certain physical health conditions like chronic or respiratory diseases and chronic pain. We understand factors related to coping such as addictions, self-harm, eating disorders, obesity might develop, and that people can have ongoing relational difficulties where they may end up in situations of domestic violence or have multiple or unintended pregnancies. Trauma can affect every aspect of our bodies, which is why we say no mental health without physical health. The two are intertwined.
So how would a GP know if a particular life problem was related to trauma?
Well, it goes without saying that we don't know what kinds of experiences our patients have before they come into services. But what we do know is that if we presume that their issues are not related to trauma, then we miss a great opportunity to ask the right questions and to help. If we assume that trauma might be playing a role, then we start to pay attention to signs of trauma and to ask the right questions.
So could a GP or patient, what would they expect from the Jersey Complex Trauma Network?
Well, the Complex Trauma Network will provide trauma-specific advice and support, appropriate assessments and evidence-based treatments, but we know that it's about the bigger picture. So the Complex Trauma Network would be run centrally by a team of specialised clinicians who are trained in dialectical behaviour therapy, DBT, which, as you know, is an intensive psychological therapy which has been developed to help people give them skills in managing their emotions and changing behaviours which may have been causing them difficulties. The team would manage referrals and assessments so that you as a GP could refer in, and the team would organise an assessment, and if appropriate, they would guide patients through a 3-phase treatment programme which follows international guidelines. But we understand that there's more to living with complex trauma than offering treatment alone. And this is what we mean by the wider network. So from exercise to diet, from work to leisure, from concerns about health to worries about connecting with others, we know that you as a GP, along with our community and health colleagues, our voluntary sector workers, are already doing vital work which supports recovery. So a trauma-informed island is about linking this support within a trauma network that's guided by a framework of complex trauma care. The core DBT team could have a vital part to play in this to facilitate as a link to offer trauma-informed training, consultation, guidance and clinical supervision and governance. It's about supporting people to support people. We have a unique opportunity in Jersey, we're 9 miles by 5, to develop a trauma-informed island and to join a global trauma-informed movement away from a perspective of what's wrong with you towards an understanding of what happened to you, what's your story.